Technology at UWI for another in our Thursday seminar series. This morning's seminar is again another timely one, coming out of the celebration of Women in Science last week. We are talking occupational safety and health this morning. Relevant because we are in a pandemic and now more than ever, occupational health and safety is front and center. And there is no better person to talk to us about OSH matters than Dr. Norbert Campbell. Dr. Campbell is an industrial hygienist and a public health inspector with over 30 years experience practicing OSH in Jamaica. He has a BHSC degree from UTech, a graduate certificate in industrial hygiene from the OSH Institute of the University of Toronto, an MPH degree from the UWI with a practicum attachment that that was based with the National Institute of Occupational Safety and Health in the US, and a PhD in occupational environmental and environmental safety and health from the UWI. Dr. Campbell's contribution to the development of OSH in Jamaica includes being a member of the team that developed the suite of occupational and environmental safety and health programs here at the UWI, and he became its founding coordinator and lecturer. He assisted in the development of the BSc degree in OSH at the University of Technology and chaired the committee that revised and piloted the NIS Injury Benefits Claim Form and was instrumental in its development. He has also contributed to OSH in the region, having served on CARICOM's expert panel of workers' health. He served as facilitator for the PAHO Government of Trinidad and Tobago workshop on OSH in healthcare settings, and presented Jamaica's country report on workers' health at the PAHO ILO Regional Conference on Workers' Health in Barbados. So he's been quite active in the area of OSH. Dr. Campbell is currently a lecturer here in the Department of Chemistry, where he coordinates our undergraduate and graduate occupational and environmental safety and health programs. He's a member of many local and international OSH organizations, including a founding member of the Jamaica Occupational Health and Safety Professionals Association and a technical advisor of the National Environmental Health Association of the USA. Dr. Campbell is passionate about the improvement of OSH for Jamaican workers, and he is indeed, his life and work demonstrates his commitment to OSH in the region and in Jamaica. This morning, he speaks to us on the occupational injury surveillance system in Jamaica, an innovative approach to its improvement. I ask you to give a warm welcome to Dr. Norbert Campbell, everybody. Over to you, sir.
Thank you very much, Dr. Singh Wilmot, for the opportunity to share in respect of occupational safety and health. I know that occupational safety and health is quite different from the topics that you're accustomed to hearing. But occupational safety and health is a growing area of interest. And so we need to be mindful of that. Okay, I quickly in my outline, I look at the introduction background. It's based on a research that was done that I share with you, describe the ILO's framework for injury statistics. Most of the work is framed in the ILO framework, describe challenges in developing occupational injury surveillance system. We look at the current local injury surveillance system, rationale for the study, some points on the methodology, key findings, discussion, some conclusions. If you look at the global context, injuries account for 10% of global deaths, 16% resulting in disabilities. And importantly, up to 90% of those are occurring in developing countries. In respect of road traffic deaths account for about a quarter of global deaths. And in Jamaica for the past since 1992, we have been having more than 300 every year, except I think 1 year we had under 300. In the area of homicide, Jamaica ranks second as highest homicide rate in the world. And in a recent report from Inside Crime 2020, that we are the highest rate in Latin America and the Caribbean. More specifically, in terms of workplace, about 380 occupational injuries occur per year. And if you count commuting accidents, meaning accidents occurring on the way to work or from work, can get up to 500,000. It is important to note that occupational injuries are decreasing in developing countries, but they are decreasing in developed countries, and increasing in developing countries. When we look at the burden of occupational injuries and diseases, the ILO estimates that it accounts for about 4% of gross domestic product globally. Pan American Health Organization estimates that it could be as high as 20% for some countries, in some developing countries. Now, if you look at the data here, looking at countries in the Caribbean, just for comparison, and just to highlight Jamaica here, the International Labour Organization estimates that we have about 181 fatal accidents per year, while Jamaica only reports 6 on average, for that year 6, but the average is about 6-7, and reporting 811 causing for lost time injuries. So this is the important part I want to focus on in terms of what the situation is. We are reporting 6 when the estimate is 181. I'll come back to that. It is important to have an understanding and indeed an appreciation of the definition of occupational accident. Intuitively, we think of occupational accident as an unexpected and unplanned occurrence. That is true, but many persons do not recognize that violent acts are also included in occupational injuries, providing that they take place at the workplace or in the line of work. So traffic accidents are also included in your occupational injuries. In respect of surveillance, the National Institute of Occupational Safety and Health describes it as the ongoing systematic collection, analysis, and interpretation of data to improve safety and health. The American Public Health Association has a more relevant definition, I would suggest, where it says the prompt dissemination of results to those who need to know, and particularly those who are in a position to take action. So the issue of surveillance is about taking action to improve health and safety. Globally, surveillance systems, no true system basically exists. And sometimes you have contamination of occupational injury data with even injury data with disease data as well. You have also deliberate exclusion of large numbers of workers from national estimates. In some countries, the law will tell you that it does not apply to facilities employing under 5, under 9, under 10 workers. There's clearly severe underreporting and non-reporting, even in developed countries. Professor Lay noted that even in the United States, that is reputed for good quality record reporting, that up to 70% of occupational injuries last time were not reported. So because so many countries do not report, particularly developing countries, extrapolation is usually done for non-reporting countries. And by that is meant countries where they are known to have good data in a given region, similar population, similar work setting. They would use data from that countries to extrapolate for non-reporting countries. The International Labour Organization, these are the documents that typically guide global occupational injury surveillance. And the one that I want to focus more on is the International Labour Organization's Code of Practice in Recording and Notification of Occupational Diseases. Because most of what I've done in terms of the instrument design and coding of data has been based on that system. The ILO's framework essentially is based on the issue of work taking place in an establishment, type of industry, the size of the industry, a worker gets injured, so data about the sex, age, occupation, status in employment, facility owner, supervisor, the time of the accident and the location, what was taking place at the time work process, the sequence of events, what deviation from the norm resulted in the accident, mode of injury, what actually caused it, and ultimately the result, what type of injury the body part affected, and the consequences, be it death or permanent disability. If we seek to define injuries more clearly, you could have a dangerous occurrence resulting in no injury, or that which results in injury. And the injury could be fatal or non-fatal. If non-fatal, you could have what we call lost time days, meaning days lost from work, or no day lost from work. If no day is lost from work, we call those restrictive accidents or restrictive activity, meaning that the worker did not go home, but went to the doctor, went to the nurse, but went back on the job in the same day. And lost time would be permanent or temporary incapacity. Looking at the global surveillance systems, they tend to be more accurate in developed countries than developing countries. In most countries, multi-agencies have responsibility for the systems. Some countries even separate health from safety, which is really not right. And you can also augment those national systems with periodic surveys. You have also inspection versus compensation systems. Inspection systems are driven by inspectors, as the name suggests, while compensation systems focus on payment made. For example, National Insurance Scheme in Jamaica makes payment, but they don't focus on inspection. Fault versus non-fault compensation schemes. Fault schemes are when the worker can be held liable for causing the injury or the accident. No-fault systems are when, irrespective of whether or not the worker is at fault, the worker is not held accountable in the sense that it is the worker that caused it, hence the worker will not get a benefit. Benefit will be given irrespective. And the value of that system is that it encourages workers to report accidents. Now, most countries will collect data based on their own needs, but the reporting of non-fatal injuries presents the greatest challenge. Fatal injuries tend to be able to count better, but in many cases, for example, like Jamaica, we do not do a good job of counting even the fatal injuries. And most countries that have good lost time injury data is when they have 100% compensation that they make claims. So persons will be encouraged to claim. In Jamaica, our surveillance system is based on the ILO's code, but there are major departures in some agencies. The Mines and Geology Division, for example, that produces the best quality occupational injury data in Jamaica, does not record the data by sex, which is a basic requirement. The Ministry of Labor, Occupational Safety and Health Department, they report accidents on a calendar year, on a fiscal year basis, I'm sorry, while the ILO requires calendar year. And the National Insurance Scheme, for example, counts the day that the accident occurs, while the International Labour Organization's guideline is that you do not count the day on which the accident occurred in the documentation for global practice. So these are major differences. 4 agencies of government in Jamaica have surveillance systems. The Ministry of Labor has the NIS and the Occupational Safety and Health Department. The Ministry of Health has the Jamaica Injury Surveillance System, and the Mines and Geology looking at the mining sector. Now, what is important is that although the Occupational Safety and Health Department and NIS are in the same ministry, there's little or no collaboration between them. And it's instructive to note that the majority of Jamaican workers are not covered by any OISS legislation. Only the workers who are working in factory type settings and those that are working in the mining sector are covered by current legislation. If you look at data from the Occupational Safety and Health Department and you compare that with data in the mining sector, when you calculate the rates per 100,000 workers, you'll find that the situation is worse. The data is suggested in the mining sector. No one believes that. It is simply because of under and non-reporting in respect of the general factories, because the mining sector has good data and does a good job in terms of surveillance. So in terms of the rationale for this study, the global estimate of occupational injuries for Jamaica is about 30 times what we have in terms of fatal injuries, about 170 times greater for lost time injuries. Severe under and non-reporting is believed to be the basis for the absence of urgently needed policies and legislation, such as the eminent occupational safety and health legislation that has been in gestation for 25 years now. The cost of occupational injuries and diseases can be up to 25% of GDP. We do not have good quality data in Jamaica, hence we are not being able to make that assessment. But even if you consider that Jamaica, using the global estimate of 4%, if we could reduce by even 2%, our effort at having growth in the economy beyond 1% could be realized by this route. The burden can be described with accurate data, but until the injuries are counted, we cannot cost them. And that's the important thing. We have to count them first for us to put a cost to it. And it is when we are able to cost them that the burden can be aptly described. If we consider that injuries are preventable, then we can transfer this burden into savings. Jamaica's vision for 2030 can be significantly enhanced, in my view, by paying attention to occupational safety and health. And this is my proposed model for the surveillance system. These existing sources of data, Ministry of Labor, Ministry of Health, Ministry of Mining and Transport, and I am suggesting other sources. And in these major sources, you have as primary data sources, National Insurance Scheme, the Occupational Safety and Health Department, Ministry of Health Hospital Surveillance System, Environmental Health Unit, and the Mines and Geology. And if you look at other sources that I have identified, I call them secondary sources. Online news media, the National Road Safety Council and the Police Traffic Division, Coroner's Court reports, but more so Jamaica Constabulary Force homicide reports, and private insurance. If we drill down further, we could look at healthcare facilities as major sources. So in this study, we were able only to get data from the National Insurance Scheme, the Occupational Safety and Health Department, Mines and Geology, the online sources, and from the National Road Safety data set. In terms of research questions, what are the inadequacies in the Jamaican occupational injury surveillance system? Can a revised occupational system provide detailed description of the epidemiology of occupational injuries in Jamaica? To what extent can reliable and internationally comparable occupational injury data be generated from existing sources of injury in Jamaica? What are the perspectives of key OISS stakeholders on the proposed occupational injury surveillance system and the likelihood of its being accepted and implemented? I condense the aim: develop and pilot a prototype for an improved occupational injury surveillance system based on international guidelines, and to use the output of that system to demonstrate that Jamaica can generate more reliable occupational injury data. And the methodology was a mixed method study that used both quantitative and qualitative at the same time. The qualitative component, we had key informants interview and we had focus group discussion. 8 policy level key stakeholders were interviewed and a focus group discussion targeting 10 invited participants. We had 6. And the inclusion criteria there was 5 from non-compliant and 5 from compliant facilities. The quantitative component was primarily secondary data abstraction from the National Insurance Scheme, from the Occupational Safety and Health Department, Mines and Geology database. Also fatal data from the National Road Safety Council. And in this study, we use all cases of drivers of PPV and commercial motor vehicle as being work-related, because those we take to be work-related. In terms of fatal injuries, we looked at online sources. Each report that was identified was read by the investigator to establish work-relatedness. Only cases where work-relatedness could be clearly established were included. And some of the captions that you had were like taxi driver or cabbie driver murdered, but only those cases where clear work-relatedness could be established were included. For example, while letting off or picking up a passenger, while plying his route, or he left his house to pick up a passenger, descriptions like those would result in inclusion. Compilation of the data set was a three-stage method. Stage one, we combined the data from NIS, the Ash Department, and Mines and Geology into a consolidated data set here, 2018, which was primarily used for the analyses. The other stage was to add the data that were gotten from online sources, which resulted in about 3,255 cases. And this was restricted to be used in cases where fatal injuries were addressed. In terms of the analysis for the quantitative data, SPSS version 17 was used. Demographic characteristics were described using mean standard deviation. Differences between variables were explored through chi-square, and dependent outcome variables were based on literature and guidance from the ILO manual, typically degree of injury, severity of injury, time to injury, and body part affected. For quality assurance measures, the NIS form was primarily the source used. Doctors validate that because each one has a physician's report, and the employer also validate the occurrence of the injury. 10% of the data abstracted were checked on site for validation, and they were coded in keeping with the ILO requirements. For the qualitative data, key informants interview and focus group discussions were transcribed and augmented with investigators' notes. Codes and definitions were developed, and open coding constant comparison was used. Categories, subcategories, and themes were developed from those tables. Key findings, quantitative. The most outstanding finding was that for the period in question, remember we said that Jamaica, the ILO estimates that we have 181 cases per year of fatal occupational injuries. In 2008, the combined report from NIS and OSH Department 12. From this study using the methodology described, we found 85. 60 of those came from the online media sources. And you can see that for each year, even when Jamaica is reporting one, you had 41 clear cases that could be identified as work-related. In terms of compliance in reporting injuries to the Occupational Safety and Health Department, only 1.5% of the injuries were reported within the legal time frame. 43% of the injuries should have been reported to the NIS, should have been reported to the Occupational Safety and Health Department based on report to the NIS. What you find is that persons are more inclined to claim and not to report. So over 56% of the cases were not reported. And most lost time injuries were supposed to be reported within 3 days of occurrence. The average time was the mean range was between 21 and 40 days that it took for reports to be made. In terms of fatalities, of the number of cases that occurred, there were 12 of them, and only one was reported in the correct duration. It should be reported forthwith, the law says, and only one was reported in the same day of occurrence. You had fatal injuries taking as long as 39 days to be reported. And I found cases in the NIS database where no report was made to the Occupational Safety and Health Department. If you look at violent injuries, you notice that companies are not reporting violent injuries as occupational. What they told me in the study is that they report those to the police. So 96% of the violent cases that were identified came from online sources. In terms of non-fatal, non-violent injuries, more representative reporting is done here, but the bulk of it still is from the online sources. In terms of particular groups that are at risk for fatal violent injuries, taxi drivers and bus drivers came out to be the group that was at greatest risk, even higher than the police. Business persons were also found to be third in line here. And in terms of other, 21.7% are those for which occupations were not indicated. But you see the taxi drivers, police, business persons ranking high. Other findings in terms of Paris, St. Catherine had the largest number of injured workers, followed by Kingston and St. Andrew, Clarendon. In terms of occupation, unskilled workers were the majority of injured workers, and service and sales workers, that category by the ILO, was next. And in that category, the police accounted for 41% in that group, and the police accounted for 12.6% of the overall claims submitted to the NIS in the period. In respect of sex, males were at least about 4 times more likely to be injured fatally than females, about 70% higher there in terms of non-fatal injuries. Now, variables that were significant on univariate analysis were put into the model, and the sex was the variable that was found to be significant in the multivariate models. And as males were 3.5 times, 3.6 times more likely than females to have fatal occupational injuries. In terms of our qualitative findings, the emerging themes, multiplicity of injury reporting experiences, some factors facilitating or hindering the reporting, how payments for lost time, sick days, and related costs were addressed in the respective establishment, their experience using the revised form, and the perspectives on the standardization of reporting requirements. And I just use 2 here, multiplicity of reporting experiences. A representative from the bauxite alumina sector says that we use a very comprehensive form that calculates all the data about the accident, and it is more geared at investigating and root cause analysis. Our focus is that such an accident does not happen again. So we even report first aid cases, and that is so in the bauxite sector. Even first aid cases are reported. Participant from sugar industry said, we are expected to report it upon occurrence for their internal, whatever they have to do with the insurance side. The company says report everything, because if we don't investigate properly and document the real cause, we will encounter a large number of lawsuits. In respect of their experiences in using the revised employment injury benefit form that was piloted, experience varied from using the claim form to not using it at all. I learned in the focus group that the majority of companies are not making NIS claims at all. And so they use their private insurance claims. And so that was interesting for me when I thought NIS was the primary source. The EIB form, if used, was completed typically by the company nurse. One respondent said the nurse at our place does it, and sometimes she doesn't have the details of the accident because it's done by more than one person. And how would she know if she doesn't get it from them? One other person mentioned there's one question that I do not answer, and it's the hours. I don't know what it is, as it is not provided in the internal report, so I cannot report on that. It's a participant from a food manufacturing facility. One respondent said, I am doing triple reporting right now. I report to Health and Safety Committee. Then I have to write another report for my insurance. Then I will have to write up this form. I believe the process itself is a hindrance. To fill out all these huge forms every time we have an accident is a bit barbaric. There has to be an easier way as a participant in an educational institution. And for more key informants interviews, the emerging themes: use of national and international occupational injury reporting systems, their perspectives on the existing and proposed occupational injury surveillance system, and the proposed occupational safety and health bill. Those were the themes that emerged from the key informants interview. And I picked this theme, their perspective on the existing and proposed occupational injury surveillance system. All key informants recognize the inadequacy and inefficiency of the current systems. One non-regulatory key informant said, I am concerned that there is nobody that will collect the data from all these different agencies so that we can get a national picture. This is not only unfortunate, but ridiculous. Key informants express diverse views in respect of the reasons for that situation and the role that some regulatory agencies have played in its perpetuation. One regulatory key informant said, I think that we are doing ourselves a disservice. My brain just can't follow why, but I think it is a government department thing. Everybody wants their own system. Because we were proposing that to standardize the data recording collection system for the respective agencies, and that would enhance compliance by industry. All except one key informant endorsed the proposed system. And the one who did not endorse the system was a key regulator, which makes it very, very important. That regulator said that in respect of collecting data from the various sources to make the national report, he said, that is what I would say is nice to know information. What I think is a better way forward is that we shore up existing systems first, and then with a view in the future to deal with those things. He said, no, with the government, we may not get the buy-in because data from all these sources is going to present a poor picture. I don't think the minister will necessarily want to have that presented. It will put the country in a bad light. So that was, and that's very important because it was from a regulator. And in the discussion, the proposed system provides an improved estimate of occupational injuries. The incident identified is significantly less than that established by the ILO, but significantly higher than what is reported by Jamaica presently. The proposed system utilizes multiple sources of injury information, incorporating non-traditional sources such as media, reporting, and national road safety data, and to arrive at the estimates. Key stakeholders, including management, workers, and regulators, endorse the system. And in comparison with developing countries, substantial contribution of homicides, 96% in this study, and fatal road traffic injuries, 64%, are untapped sources of occupational injury data. And that has been also reported by Hemingway. The high incidence of male injuries is consistent with findings in many other studies, where studies have found 80% of fatalities among workers, 80% lost time, 92% fatalities. In a 2020 study, 96% of lost time injuries in a study done in Ethiopia. The identification of manufacturing and agricultural sector as sectors yielding the most injuries is consistent with findings in numerous studies. Those are high-risk industries. The finding, however, of the construction sector being just 1.2% is inconsistent with findings, as construction is a very, very risky, high-risk industry. The fact that only sex predicted the risk of fatal occupational injuries is also not surprising based on the number of males in the as taxi drivers and bus drivers. In terms of the qualitative component, the proposed system, widespread acceptance by all key informants, except for the one that was mentioned. The piloted NIS form needs to be finalized and fully implemented, but the full involvement of key stakeholders is required. The piloted form was deliberately designed to include all the data required by the Occupational Safety and Health Department, so that as required by the ILO. So once that is accepted by the Ministry of Labor, they will be collecting data for both NIS and the Occupational Safety and Health Department, putting less burden on industry. The proposal to expand for private insurance healthcare providers is consistent with best practices, and many developed countries are using that. The support of the Jamaica Constabulary Force is critical in providing roadwork and occupational homicide and informal sector data. And very importantly, the proposed system can be implemented whether or not the OISS bill is passed. And quickly, as I wrap up here, looking at the system as I presented it before, we use these areas in gray, but the information from the police can provide information from homicide report, and all occupational injuries will fall in this. And so if we get the police on board, then we'll be well on our way in defining actual numbers for fatalities. The insurance companies, if we get information from them, will assist in dealing with the burden, the cost of the injuries. Results have justified the targeting of NIS as a primary source of data, and the burden of occupational disease in Jamaica is much greater than what is believed by stakeholders. The injury surveillance system proposed in this study can accurately identify fatal injuries in Jamaica, and as such, should be adopted by the Ministry of Labor. And I have a few recommendations here, but in the interest of time, I'm gonna just stop here. Because I know you want some questions. Dr. Wilmot, I have probably, all right. Let me take 2 more minutes.
Yes, I think you can take 2 more minutes.
Okay, fine. Some key recommendations coming out of the study. So the final revision and adoption of the piloted instrument by NIS and also by the Occupational Safety and Health Department, because it covers all the requirements by the ILO. And if taken on, we'll be well on our way. The Occupational Safety and Health Department should utilize the non-traditional sources identified in this study as a means of getting data, even if the legislation is not passed. The government naturally should do its work in passing the legislation, which is 25 years in gestation. An urgent need for training in occupational injury recording and reporting, both by the regulators and the regulated. The Occupational Safety and Health Department would benefit from an island-wide study looking at household survey and also industry survey to establish the current situation in terms of occupational injuries. A simple way could be to add a few questions to starting labor surveys to get those type of data. The Ministry of Health also has a significant role to play in its hospital Jamaica injury surveillance system, because the worst cases go to hospital, and that system is not working just now, but they need to revamp and bring that to fruition again. There are some limitations of the study, lacking in external validity due to the lack of representativeness of the sample. Only injured persons who claim NIS were really included. 85% of the respondents were from NIS claims. And so how different were those persons who claimed from those who did not claim or who were not injured? Secondary data was the primary source, and different persons compiled these, and therefore the potential for variability in accuracy and consistency. And I believe I could have had more focus group to enrich the experience. Study is believed to be very valuable though, in terms of it provides a tool that can be immediately implemented by the Ministry of Labor. The study has provided the most comprehensive work to date and provides a national report for the first time for Jamaica. The qualitative findings are really instructive in terms of policy orientation in occupational safety and health surveillance. And the study findings can inform the legislation that is pending to enhance its successful implementation. And those are my acknowledgements. Thank you very much.
Thank you very much, Dr. Campbell. Ladies and gentlemen, you join me in giving a round of applause to our speaker, Dr. Campbell, on a very important matter this morning. And he has left us with enough time to have a robust discussion. So I'm opening the floor for questions or comments on this matter of OSH and surveillance systems. Would anyone like to start? As usual, I am going to continue until you come up with your questions or get a chance to open your microphones or put your hands up. Dr. Campbell, can you comment on how these surveillance systems would need to pivot in the face of the pandemic, in the face of the COVID-19 pandemic?
Okay. The systems that I've described really focus on injury. Now, what is more useful in controlling issues related to the pandemic would be having occupational safety and health systems in the workplace. Injury would just be one part of that. So in a number of organizations, for example, the establishing of continuity plans, contingency plans. And even though no one would have envisaged the impact of, say, COVID-19 on the economic side, but if you had systems in place, you'd be better off than the company that didn't have any to start from scratch. And what I can say to you is that I'm very sure that going forward, as a result of this experience, many companies will be well on their way in terms of in the event that similar situations would occur. For example, I expect going forward that in designing and laying out, say, factories, they will have, in terms of the space per worker, that you can allow, instead of each worker side by side, you do that when everything's okay, but you set the machine such that you can skip a worker to get 6 feet space, that in the event that you need to have separation for 6 feet, you will be able just to move to that readily. And those are some of the things that I expect to see happening. Even in terms of the wearing of masks generally, I am waiting to see when the flu season ends, what the numbers are going to be, because I believe that we are going to have significantly lower exposure, cases of influenza this season as a result of the protection against COVID-19. And so as we go forward, a number of things I believe are going to change. Because how we usually shake hand and greet, I'm not sure if we're going to be that, exactly that way and, going forward, because as you see the benefits from this system and the wearing of the mask and what it is said to be able to protect and prevent, there's value there.
So would we need to rewrite some sections of the pending legislation to account for or to deal with that?
All right. My answer straight up to you is I am suggesting no, and I tell you why. This law has been coming for 25 years, and I've heard persons saying that we need to amend what we have to address COVID type situation. Where we are right now, Jamaica is way behind many countries in terms of when we're talking about conventional hazards, noise, and chemical exposure. Many countries are at the point of looking at stress and those types of issues, not the traditional ones. And therefore, we need to start, as I had the privilege of addressing the Select Committee of Parliament, and that's the guidance I gave them. I told them, pass the law, and the law has a section where every 5 years it's subject to review. So what you could do, pass what you have based on what we can do and capable of doing. Because let me tell you, my own fear, my worry is that even if this law is passed, it probably cannot be implemented, many aspects of it, believe me. And as I told them, it will be so sad that after 25 years you pass the law and it can't be implemented. because there are many provisions in the law that things need to be done to get those in place, and they are not being addressed.
Yes, I totally agree. Thank you so much for that. Dr. Sadler McKnight, please go ahead.
Thanks. Good morning, everyone. Very interesting and useful survey, Norbert, and I congratulate you on the study.
Thank you very much.
Some of the questions that I had, you touched on them a while ago, issues relating to psychological and, sort of stress or mental issues that result from the workplace environment. And I note that you say this is something that other countries have looked at, and maybe the next round of our deliberations that will be included. Also, the issue of private insurance claims and involving some of those in your study. But what I wanted to just ask you quickly is, were you able to pick up anything that may have come out of like educational institutions? Were you able to sort the sort of number of reported incidents based on companies or types of companies? I saw you mentioned bauxite companies. What about educational institutions? Anything that was interesting from those type of organizations?
All right. More those persons from educational institutions who claimed NIS, like say teachers and so on, would you'd have data from those. But I think more so in the focus group discussion, which we had at tertiary institution rep in the focus group, what the person mentioned was that when they got the job, nobody told them as to what are the things that should be reported to. And so that person said, I wasn't reporting anything to NIS. I wasn't reporting anything to the Ministry of Labor. I did not know at all until you raised this thing about Ministry of Labor reporting. I did not know. So I think this issue of awareness is a very, very important issue. And that same respondent noted that if I don't get a report within the organization,
Hello?
It seems like his connection is out a little bit, Dr. Sadler McKnight. I think he froze right there. I am hearing you. Are you hearing me?
Right, I'm hearing you clearly.
Yeah, let's see if he'll come back on. Give him a couple seconds. And let's see. So it seems like he did look at some tertiary institutions. And okay, he's back. He's back now. Continue, Dr. Campbell. Unmute your microphone for me. Let me see if I can help you with that.
Yes. Good. Yeah, I was saying that educators and healthcare persons are guilty in that many scholars, for example, researchers spending time in a lab, searching for key answers. They are not mindful enough about health and safety. And there are many persons who have, had signal discoveries. And you probably award them posthumously for the work done. And so I always, when I talk to educators and medical persons, I always say that the knowledge that we have must guide us. Who guards the bodyguard? And you're gonna have to use the information, because just think of if government sets permissible limits for exposure, many researchers, they don't apply because you spend time in the lab until you find out what you want. It's not 8 hours. And those legislation, those guidance are only applicable to 8 hours. So many times persons are not even provided with or using protective gears. And so it is very, very important. And one of the things about the new law, I can say, Dr. Sadler McKnight, is that the law that is coming for 25 years though, it will cover workers in all occupations. So that as a result of that, employers will now have to provide safe environment for the workers. And I think students are also included in the present legislation. Now, there are many persons, including myself, who believe that one of the reasons why government has been so tired in moving forward is that government is the largest employer of labor. And government has two roles to play. One, in its capacity as an employer of labor, it needs to get its own house in order. Also, the infrastructural requirements to implement this law is substantial. And I said that to them in Parliament because they put a lot of burden. For example, one of the most contentious issues in the bill is that it gives workers 4 rights. And one includes the right to refuse unsafe work. I don't think there's a problem in everybody would accept that one should refuse unsafe work. To me, the important question is what constitutes unsafe work? And so if that is not clearly defined in a manner that it addresses the interests of the worker and the employer, you don't want the worker to turn up at work to say this morning that I am not going to work because I watched a movie last night, I watched a documentary, and my job is not safe. Or for the employer to expose the worker to precarious employment. So as I told them in Parliament, these are things that they need to pin down. My personal view is that that section should say that they should refuse what is called immediately dangerous to life and health exposures. No, it shouldn't be that you just feel that the noise is loud today. Same noise you had yesterday. It can't work like that. So these are some of the nuances that must be sorted out and the competence of persons. Because when a worker refuses unsafe work, so-called unsafe work, you want the investigator to be able to adjudicate in a very short time so that the employer, because the law says that the worker should be placed at a safe place until the assessment is done. This assessment can't take days, nor weeks, because the employer, I saw the comments from Employers Federation, they say they should have the authority then, if the work is adjudged to be safe, to penalize the worker for the number of hours that the worker was not working. And the law doesn't allow that. So these are very, very interesting. And I think the most of the debate in Parliament now, for the half day that I was there, focus on that issue. So I don't know if answer your question, Dr. Sagla.
Yes,
but
yes. And linked to that would therefore be some way to capture the sort of best practices that the companies that have fewer reports, the systems that they have in place, to what extent those can be, replicated in institutions that don't have something going on right now. But I noticed the data span 2008 to 2012, and it would be interesting to see what has happened since then.
Right,
and
so we're going back for that.
Right, and I think too, I just wondered if our students engaged in the bachelor's and the master's program in the OISS programs could be engaged in collecting data continuously as part of a research project course or something. I must admit, Norbert, I'm not so familiar with, and I know we are moving to change that, but I think this would be something that could be ongoing. So as part of a small research project for the bachelor's students, they could be collecting, data. For example, somebody could be looking at the private insurance companies, so that there's always this repository of data, current data, that our OISS department can provide, for policy and for, refinement. So rather than wait until, we have it going on all the time and refining on getting the thing. So we have a perfect thing being able to be rolled out, by the time things get approved and implemented. That's just my take on
right.
it.
Yes, Dr. Sagla, that is true and relevant. We have some work to do though in terms of forging linkages with the private sector. I remember I wanted to do a study to collect some primary data, and I had major problems. My pilot questionnaires, I didn't get back those. So because of suspicion, I remember working with a company because I got the approval from the CEO to pilot my instrument in a number of companies that they had. And when I went to one company, I spent the time with the safety person to fill out, and there was just one bit of information left that they needed to give me the workforce size that I could do the calculation. But I just could not get it. I kept calling, and one day said to me, Mr. Campbell, I tell you the truth. you're not going to get it, because the people say that they did not report this to Ministry of Labor, and so they're not giving it to anybody. And so we need to work with them for them to understand that as researchers, in terms of confidentiality and so on. So those are some of that. So I have been working with the Employers Federation, participating in their seminars and so on, building linkages so that we can access those, because they have, like, you could conduct studies looking at their, using a membership list for those companies and so on. But we need, a number of our students have been, master students have been doing some amount of research, but more so in their own companies, because we still need to bridge that gap in having access. NIS is okay. We have been getting access to NIS data, but it's private sector insurance data is what I want to target in addition.
Thank you very much, Dr. Sadler McKnight and Dr. Campbell. We are still open for maybe one or two more questions just to get the wider audience involved in the conversation. Is there anyone who would like to jump in at this moment? Okay, I don't see any more hands out there. So do we have enough data about the UE situation, Dr. Campbell?
I don't think so. No, I don't think so.
You smile when I ask that.
All right. I think that there are a number of important and very useful initiatives I've seen at UWI. For example, UWI has a health and safety committee, and that I think is a good thing. I have my concerns about its composition, in the sense that persons with occupational safety and health training and so on, I would think that since those persons are in the university, those are some of the persons that you'd want to have on such a committee. So those are some of the concerns. But I see, for example, UWI HR has been doing quite a bit of work, producing documents in terms of health and safety related. And also, I think there is a post now in HR for an occupational safety and health person that has been employed there. So those are steps in the right direction. And I think with all the resources in the UWI, we could come together and enhance that system. But I think it's a step in the right direction. It's commendable, but it can be strengthened and ought to be strengthened.
Okay, all right. I think with that, because you know, those of us who work here, I don't think have been engaged enough in these conversations about OSH and our own safety and health in our workplace. So we're hoping that the UE community can get more active in this conversation. And as the data come out, we can be informed about our own workplace, you know, so that we can use that as an example when we go out there to lead the nation and the region.
But what I can say to you, Madam Chair, is that my position over the years, when I spoke to, for example, Professor Kawa as was head of department, dean, deputy principal, and director of the OSH program, that we have to set example. We can't teach OSH and then we are not living up to what the requirements are. So we have to set example, and so that's my belief, and we have to work towards that.
Right, and we are indeed looking forward to you leading us in that. We are happy to have you present this morning in our seminar series, and we look forward to hearing more about your research projects, you and your students. Remember, those of you who are listening, I think I see at least one or two undergraduate students. We do have these OSH programs in the Department of Chemistry. They are very attractive with the legislation coming, of course. There will be more opportunities for OSH professionals in Jamaica and indeed in the region. Thank you so much again, Dr. Campbell, for an interesting study and for all that you do for our country and our region. And we are proud to have you. We have a comment here in the chat, in fact, which is just coming in as I close, from Dr. Gajada, who is in St. Lucia. Norbert, are you seeing it? She says, institutions need help with respect to the management of OSH. ISO 45001 provides some guidance on this, treating it in a holistic, integrated manner. I wonder if you want 2 closing words in response to her comment.
That's spot on. ISO 45000 is the occupational safety and health standard. And so there are companies that are availing themselves of that facility, because there are many companies in Jamaica now that have signed in terms of ILO certification, because they need to export into Europe and those places. And so by having those type of validation, it enhances the attractiveness of their product. Because I was saying to you before we came on for the webinar that many countries are now looking at what are the conditions under which you make your product. Did you use child labor? Were they made in sweatshops? We're not buying. And so what I want to think about the surveillance system, that in many countries where it is well established, companies use it in promoting their own companies to get contracts. Because if the industry rate is 15, but in my company we have 5 and we have 10, so we're saying that we are better. And in some countries where insurance is paid based on your experience, like when you have motor vehicle insurance now in Jamaica, like your accident history and so on, so you get preferential treatment if you do have accidents. In some countries where you have like the national insurance scheme, they evaluate each workplace and your premium for insurance is based on the level of risk. I asked the director for NIS about that, but he laughed. He said, no, we're not even thinking about that at this time. So, but that's the way to go. And many companies in Jamaica are availing themselves of those international standards and benchmarks to enhance their attractiveness for markets in like Europe, North America, and so on.
Thank you, Dr. Campbell. And so we are off to a good start. Dr. Sadler McKnight is reiterating this point that she made to you earlier. Good start, Dr. Campbell. There is so much more that needs to be done, and the UE needs to be the leader through its practices as well as its policies. And so with that, we are going to once again tell you how very proud we are of the work that you're doing, especially because it's coming out of the Department of Chemistry. And we want to encourage you to lead us through our practices and policies. Ladies and gentlemen, please join me again from wherever you are, giving a round of applause to Dr. Norbert Campbell and saying congratulations for all of you who are working in OSH and for all of us who are working in the department and supporting these programs. We're asking many more of you students to come over. Dr. Minot Cates here is saying congratulations, Dr. Campbell. And we are inviting you guys out there who are listening to tell everyone, Dr. Gajada and all of you in other Caribbean countries who are listening, about the programs that we offer here at UE in the Department of Chemistry. And you've seen it for yourself, the leadership that we have in OSH, in Jamaica and in the region. Thank you again, everybody. I've said this 1,000 times, and I want to wish you all keep safe, walk good. We'll see you again next week, same time, same place, right here for our Thursday seminar. Dr. Roy Porter, you have the last word. Glad you accepted our invitation to come to Chem. That is our past HOD. Yes. What it took to get you, Dr. Campbell, to be with us here in chemistry. Thank you again, everybody. See you next week.
Thank you too.